Massaging the abdomen to stimulate the colon can help trigger rectal urgency and facilitate passing bowel movements. This technique is called the ILU Mobilization because you will be tracing the letters I, L, and U on your abdomen. To do this, you will be tracing 3 sides of a square around your belly button, just as you can see here. I like to start on the left-hand side because that is the end of the colon. Think about it like this. If you want to enter a crowded elevator, the people inside need to leave before you can enter. The colon works the same way. We need to empty the left side of the colon so your body can process the stool from the top and the right side down over to the left and ultimately pass the stool out of your body. I typically recommend performing ILU mobilization first thing in the morning as part of your morning bowel routine. Here are your basic pathways. The I going down on the left, the L across and down, and the U up, across, and down. Apply some massage cream or practice this in the shower. Find the base of the left side of your ribs, your belly button, and your left hip bone. Draw a line between those 3 points straight down towards the floor on the left side of your abdomen, pressing in firmly so that you are activating the colon underneath the layer of abdominal muscles. Repeat this pathway 5 to 10 times. If you hear your stomach gurgling, that's a good sign. If you notice acute pain, stop and talk to your medical provider. The next section is the L. Find the base of your ribs from right to left and your belly button. You're going to be tracing a line in between those 2 points, this time going horizontally from right to left and then down towards the floor over the I section you already massaged. Again, traveling right to left and then straight down towards the floor. Repeat this pathway 5 to 10 times. Again, noises are a good thing. Acute pain is not. If this makes you nauseous, you are probably pushing on the stomach. Move your fingers closer to your belly button. The final section is the U. Find the right hip bone, the belly button, and the base of the right ribs. Trace a line between those 3 points, up on the right, across, and then down on the left. Again, up, over, and down. You're tracing the new section on the right, as well as the L that you already performed. Repeat this 5 to 10 times. If successful, the massage might help relieve abdominal discomfort and help trigger a bowel movement within the next 24 hours. This variation can sometimes be more effective. You're going to trace the same overall pattern but with one small difference. Find the vertical line between the left side of your torso and your belly button. This is your I pathway, but this time you're going to start at the bottom of your belly and trace up towards the top. You can see I'm massaging in a curlicue fashion. Repeat this pathway 5 or 10 times to activate this left side of the colon even more than what you've previously done. After you massage this 5 or 10 times, then you will sweep from top to bottom in the I pathway just like you did with the first technique. Repeat this 3 to 5 times. Next, find your L pathway between the belly button and the base of the ribs. Normally you would trace over to the left and down to the floor, but this time you're going to start on the left side of your upper belly, drawing those curlicues across over towards the right side. Do this 5 to 10 times to stimulate this section of the colon. Once you've done that, then you will sweep your fingers from right to left, coming across, and then down towards the floor in the L pathway, just like you did in the first technique. Finally, find your U pathway. From the right side of your torso and your belly button, normally you would trace the line up, over, and down. But this time you're going to start on the upper right abdomen and draw those curlicues down towards the floor 5 to 10 times to stimulate this section of the colon. Once you've completed that, then you will sweep up, over, and down in the U pathway, just like we did in the first technique. This variation allows increased stimulation of each colon section and can be more effective at triggering urgency.